We're here with another week of the Weekly Engage, and today we are talking with two doctors from Hard Memorial Health. Lance, will you introduce them to us?
Sure. We're here today with Dr. Matt Stiles and Dr. Dave Sindler. They are representing the Family Medical Center at Hardin Memorial Health, as you mentioned. And also, too, Dr. Sindler is representing the Nelson County Community Clinic, or NCCC. Gentlemen, thank you all very much for being here with us today. We look forward to hearing your insight on how the coronavirus and your management techniques at Hardin Memorial and the community clinic are going to help improve the reopening of our economy, get employees back into the workforce in a safe and efficient manner. So thank you very much for joining us today.
Thank you.
We're really focusing on our reopening efforts here in Bardstown-Nelson County throughout the state. And, one of the major concerns that in talking with employers that we've heard is that what happens when this potential spike that they're anticipating or concerned about in the fall, what happens at that point? And then also, too, what do you anticipate being the response as far as economically and how they manage that increase?
Well, I would say as we reopen the Healthy at Work initiatives, the recommendation, which are good recommendations that we should be keeping, would be wear a mask when you're out in public, maintain social distancing of 6 feet. That really is shown to be where the most transmission of the virus happens, is when people are within 6 feet of each other and they're not wearing masks. That's how this virus spreads. And then it would be a good idea to do some kind of screening of employees as they're coming into work. If you have a way to check temperatures, that would be great. You have to kind of create a cutoff of what temperature does someone have and they have to go home. And we have kind of decided maybe 100.0 would be that temperature. Technically speaking, 100.4 is a fever. But 100.0, usually you don't get that unless you have some kind of infectious process going on. And then symptoms that you want to look out for, one would be obviously cough and fever, sore throat, and then those are kind of our respiratory symptoms, shortness of breath as well. COVID-19 can present with gastrointestinal symptoms. So diarrhea would be the most common way it presents in a gastrointestinal way. We are finding that blood clots actually can be a manifestation. And sometimes that manifests as something called COVID toes, a new term that's out there, where people's toes are turning red because of these clots that are in the very smallest part of the blood vessels at the extremities. Headache would be another one. But one of the things that makes this virus such a challenge is that some people can have no symptoms. So you have a range of everywhere from no symptoms to, short of breath. And unfortunately, people do die of this. And so that makes it very dangerous for a few reasons. One, people can be asymptomatic and spreading it around the community. And two, it also does give people a false sense of security to say, this virus isn't really that bad. So many people have recovered. I had it, or my cousin had it, and they felt fine. But that's the case for a lot of people, but not for many. And because it's new, nobody has immunity to it. And so that's the thing that makes it really a challenge for how we're going to handle it.
Dr. Sindler, I think that you said that you all, Dr. Stiles, are working with HMH leadership on, different policies that you all are implementing in your, obviously given your profession, perhaps more cautious than other industries, but are there any other recommendations that you could think of from an employer's standpoint that they need to put into place?
The concept of viral load, that at low dose exposure over a long period of time carries a similar risk to a high dose exposure in a short period of time. So standing in front of somebody who has COVID and they are talking to you, it may take 5 minutes in order to have enough virus particles that you inhale from them in order to get infected. Whereas if you're in a cubicle at work and the person sitting 2 desks down from you has COVID and they're exhaling virus particles through the day, but you're sitting there for 8 hours, it's also possible that you're going to pick it up. So it's the concept of not just the 6 feet, not just the intermittent high dose exposure. I think employers would be well to think about the low dose long-term exposure, especially for their workers, not maybe for customers that are coming in, because customers are going to come and go. Take a grocery store, the customer comes in, maybe is shedding virus, but just for a short period of time and then leaves. Well, it's a big environment, so that virus gets diluted. The customers who are in the store or in and out, they're not particularly exposed, but the person who's working the cash register, they're there all day long. And so that low dose of virus over a long period of time has a greater risk for that person. So kind of having that mindset in addition to the 6 feet, wear a mask concept, it makes it real tricky for like restaurants, because most restaurants are not real huge. Obviously, people can't eat with the mask on, so they're going to have to take their mask off and they're eating. And if you spend an hour and a half at a restaurant, if one person is infected, they're going to be shedding a little bit of virus, and that can whiff through the restaurant some. So just, thinking about that, and that's kind of the reason I think that they've come out now, the governor and the task force or whoever, and has said, open up at a third capacity right now. It's the density of people that are in the room. If you have 100 people in the room, you're going to, even if they're all shedding low dose virus, that's going to have as big an impact as if you have one person who's shedding a lot of virus, right next to you. So it's complicated.
I think that was a great explanation of, why we should start taking precautions. Because, even they're saying for professional services, so like the chamber would be a professional service, to come back at 50%. But I think that explanation of us being in there together for that extended period of time puts us greater at risk. And then if we all got sick, then, that's 100% of your staff.
I was just going to say another way to deal with the 3 people in an office is, you can come in 3 different days, but you can also split up the day and say, you be there for the first 3 hours and I'll be there the next 3. And some,
Can it be contracted by surfaces? What is the probability of I touch the door handle and the other staff member touches the door handle?
Well, it's less. It's not 0, but respiratory droplets within 6 feet is like kind of the classic main way that it spreads. But contact surfaces and being farther apart, especially within an enclosed space, like Dr. Stiles was saying, is also how it's going to spread. So it can, but it less so. And it is, if it is outside, the ultraviolet sunlight does kind of inactivate it, but that's only on surfaces of inanimate objects and not inside the human body.
Gotcha.
Right. So, in those most highly contacted surfaces, it's going to be good practice to disinfect those a couple of times, several times a day, a policy of every hour or 2, going around and wiping off contact surfaces.
I think you have a link to a sheet that has all the several different disinfectants.
I do. It's a resource, AmericanChemistry.com. and it's novel coronavirus fighting products, and it's a 17-page list of cleaning products that are approved to clean coronavirus.
We don't
So-
recommend all of those products and pouring them into a bucket.
That would be fantastic.
Yeah, so I mean, there are a lot of products out there. It's not just Lysol, it's not just Clorox. There are a lot of other products, but it is good to be sure that you get a product that is known to be effective. I've heard people say, well, we're using vinegar. Well, vinegar is not one that works. You have to have something that can dissolve the lipid envelope of the virus. So it has to have a surfactant quality to it.
You go to the chamber website, right on the homepage, we've got a pop-up that our membership and other community members can access for resources regarding COVID-19, specifically as and how they relate to employers and management of human resources, etc.
It's right now, this virus is thought to have a reproductivity number of 2.5. So it means that each person who gets infected typically will infect 2.5 other people. And so statistically, when they do statistical work on that, it comes out to about 60% of the people will have to be infected or have antibodies in order to have herd immunity, where there's enough immunity in the community that spread will be diminished, that you won't have rampant spread. Now that can change if that reinfectivity number goes down from 2.5, and that can be impacted by the Healthy at Work initiatives and the Healthy at Home initiatives. And if people follow good social distancing, good hand hygiene, things of that nature, then that number is going from 2.5 down to where if a person gets infected, maybe they only infect one person. That's going to lower that statistical number that you're going to need in the community to have immunity before there is a diminishment in pandemic spread or endemic spread. So that's kind of the part of the initiative, and why all this stuff is important is we don't know how long it's going to take to get a immunization. We're hoping maybe by the first of the year, but that's hope. That's not hard fact at this point. But what is hard fact is we know that if you can follow these recommendations, you can diminish the number of people who pass the germ along, and then that overall helps the community by decreasing that percentage of people that have to have immunity to prevent endemic spread.
Back to that question of the potential spike in the fall.
Yep.
What if you all were to say what the likelihood of that is? What would it be? And two, what type of economic response can you imagine? Now, I know you're doctors and not economists, but based on the response that we've seen over the last several months, do you anticipate something like that happening again in the future? And if so, why or why not?
So for sure, we know that in the fall, we're going to see a resurgence of influenza virus. And that complicates everything, right? And so it's going to be more important this year than traditionally that people get their immunizations for influenza, because that will help diminish the conundrum of is this patient got coronavirus or do they have influenza? So the more we can get rid of that confounding factor, the better. So if everybody will get their influenza immunization, very helpful. Whether there's going to be a separate coronavirus spike in the fall, it's a guess really, because it's a new virus and we don't know.
And it doesn't have to actually be in the fall either. I mean, it unfortunately, we could have a second spike next week. We could have a second spike in June. And so whether the economic impact will be determined by how bad the spike is. And so if it's, if it seems like it's really going rampant and it's worse than the initial spike, obviously that would have more economic impact. If it can be, that we used to use the term flatten the curve a lot. So we're still having to flatten the curve and make sure that as we go back to work, numbers of cases are still spread out with the measures, that we've already discussed. We'll hopefully make it so that it's not so bad. One thing I wanted to mention as far as symptoms of coronavirus, nasal congestion is really not a symptom of coronavirus. So when you're screening employees, if you have an employee that has, allergies, even sinusitis, nasal congestion, runny nose, I wouldn't necessarily say that person has to go home if it's just nasal congestion and sinus congestion.
Without fever.
Yes. Yeah. If they have a fever and they're coughing, then, it's a different story. So as opposed to, sinus and nasal, COVID-19 tends to infect the lungs, the lower respiratory tract.
But not to forget that a large percentage of people are totally asymptomatic as well.
This is a very tricky disease to identify and to track. We heard this week the governor released information about we're hearing a lot of new terminology throughout all this, right? Social distancing and PPE, terms that no one heard before. And then now I think most people had not heard the term contact tracing. And so he released that this week about Kentucky's initiative to do that. And essentially what they're going to be doing, correct me if I'm wrong, you all I'm sure know much more about it than I do, but they're going to be tracking confirmed cases of COVID-19 and identifying who that individual has potentially exposed to the virus, and then following that spread and determining whether or not they're high risk, medium risk, or low risk. And so my question to you all is we haven't had a lot of clarification on the potential questions and the processes associated with when that health investigator, as they're calling it, I think, contacts them. And you all may or may not know, but what do you anticipate those health investigators, what type of questions can those individuals expect to be asked?
Well, I will say that, I am not versed in contact tracing specifically. I will say that my daughter just signed up to be a contact tracer, though. So she's going to teach me. I think it's primarily just going to be history. Where have you been? Who have you been with? And then the contact tracer will, in a confidential manner, contact those people and saying somebody you have been in contact with has tested positive, and we need you to self-quarantine and stay home, and find out who that person has been in touch with. The initial exposed person, asking them to monitor for symptoms, and if symptoms develop, to report back. So then if they report back, then it becomes that next rung of the ladder, the people that they were in contact with that have to be contacted, and kind of fan out in that fashion and try to catch it and contain it as much as possible. If we're really good at healthy at work and healthy at home and bring that reinfectivity rate down, it just makes that a lot easier to catch that one case and contact those people and try to lower that number so that you go from that 2.5 people that are infected now down to 1, and make that just, once you get below 1, then you're starting to eliminate the virus. So 1 to 1 is kind of just persistence, but once you get that number below, that reinfectivity rate down below 1, then you're starting to eliminate the risk of the virus transmitting in the community.
And so, it seems like the severity of the contact is really going to be a key issue. So, the people you live with in the house, those people, I would presume, would probably have to quarantine. So if I'm diagnosed with COVID-19, my wife and kids are probably not going to be able to go out of the house for a period of time. And I do want to mention one thing in particular, and that is, Dr. Stiles says his daughter is going to be one of these contact tracing people. And, if you're contacted by a contact tracing person, it certainly could feel like an invasion of your privacy. But their motivation is really just to try to keep the public safe. And so, I would encourage people not to treat them like telemarketers or be rude to them. Actually, I would encourage you not to be rude to telemarketers too. And that goes for people who are checking your temperature at work. These people are just trying to keep everyone safe. There's a lot of frustrations right now, the uncertainty, the anxiety, the economic impact. And so, there have been a few instances of people being rude, not necessarily here, to people who are sitting out in the front of buildings and clinics, trying to screen people. And I guess I would just encourage you to be nice to those people.
I think that's a good word of advice for any situation, right? I understand that Bardstown has, I know, added a testing site. Can you all comment on that a little bit?
Right now, I think that Bardstown has 4 testing sites, I believe. So we have testing here at our office, and we have a drive-up pavilion also here, that if somebody calls and has symptoms, or if their provider at another office is not doing testing, but they've given them an order, they can call here. It is by appointment. They can call here and get an appointment, come in, drive in, and get tested. We, of course, in addition, we also offer to, see people that are sick, not just, I wonder if this is it. They're sick, they're having symptoms. We encourage those people, they might want to be seen. I've had one patient that I saw who tested negative twice, but on X-ray had evidence that was clearly COVID. And so you had a person who was not even testing, but had X-ray evidence of COVID. And so, and that's dicey. It's like, how do you give advice on that? You've got a negative test, and I'm trying to tell you, maybe you shouldn't go back to work yet because you're coughing and you've got this X-ray, but your test is negative. If you do go back to work, at least, if you've got employees that are coming in, insist that they wear a mask. If they've been diagnosed or if they've been out for a fever, insist that they wear a mask, insist that they do good hand hygiene throughout the day. It's going to be a trial and error type thing for us.
Yeah, that's some new that really I've heard of is what you're referring to as far as the false negatives or false positives. As if we needed one more thing to kind of complicate this matter. But I think that in some, really, it just, if the employer and the employee are encouraging just practices in which just you pretty much assume that you have the disease, and then that way you're practicing the best case prevention as possible. I would assume that would be accurate.
Eloquently said and absolutely correct. Just have daily practices that I've got the disease, and when I go to the grocery store or when I go into any business, I'm wearing my mask, I'm washing my hands, I'm being careful before I do something.
I wanted to mention about testing, because when we brought up the issue of testing. One, kind of to echo what Dr. Stiles was saying, I encourage people to get testing. If you have symptoms, I would say just get tested. If you're curious or worried, just get tested. I've talked to some patients who are, they're at home, they're older, they're nervous, and I've encouraged them, just come get testing. And then that's just one less thing to worry about. And then it's actually helpful. The more people that get tested, the more we know about this virus. Before we did a lot of testing, before we had a lot of access to testing here in Bardstown, we really weren't sure how much virus there is. And since we've done a lot of testing, we've found out, some good information that, there's not a lot of viral burden here in Nelson County at this time. But we can't know that unless people get tested. Testing is uncomfortable. I have been tested. It's a long swab, and it goes in your nose, pretty far back. It doesn't go towards the brain. It actually goes more straight in, and it's actually going back more towards your throat. In my case, it's not a HIPAA violation because it's my own information, but I was swabbed by Dr. Holly McCoy, and it did bring tears to my eyes just because of the irritation of the nose. But it was gone in a minute, and then I was able to get the results that I was negative. And that was after I did my respiratory rotation. So it gave me the confidence to come out of quarantine and be back with my family. So it was really a good thing for me to do. And I plan on getting tested again next week. I've just finished my second turn of being the respiratory provider here at Family Medical Center. And so I'm going to get tested again, probably on either anywhere from Tuesday to Friday, because I want to give the virus some time if it did infect me.
Can I do it?
Yes, they're lining up.
How long does it take to get the results, gentlemen?
For us, for the test we do, we're saying 36 to 48 hours.
Okay.
Now that's during the week. On the weekend, they are a little bit slower. So if you get tested on Friday, you may not hear till Monday or Tuesday. But during the week, 48 hours.
So it sounds like to me that the best procedure for employers and employees is if they are feeling ill, work to identify the symptoms, and if they're feeling ill, to go just get tested. They need to get tested. Is that accurate?
Yes, get tested and assume that you have it until, just assume that you have it.
Yeah. Well, we've definitely gotten a lot of information from you all. One last question, and kind of in regards to what you mentioned about getting employees back into the workplace. As businesses are starting to open their doors and invite employees back into the workplace. I know that there are going to be, and there are concerns, employers have voiced concerns about the comfort level of employees coming back. And so my question to you all is are you all seeing employees come, schedule appointments with you all and saying, hey, I'm uncomfortable, and here's why. I have this risk factor, or I have no risk factors. I'm just not comfortable with going back to work. Can you all approve or write me a note to the employer saying that my time there, should be forgiven, and that, I need a little bit more time before I can come back to work?
Yeah, good question. And it is a sticky wicket, isn't it? We're running into both sides of that issue too. Another side of the issue is people saying, occasionally are asking, I don't want to wear a mask at work. I'm claustrophobic, or I don't want to wear a mask. Can you write me a note saying I don't have to wear a mask? So that aspect of it, I think as providers, we're pretty uniform in saying we feel like you need to wear a mask. We're not going to let people get a by and say, yeah, you don't have to wear a mask. Unless there's really a true medical reason, and that's kind of hard for me to think of a medical reason that you can't wear a mask. I have had employees that have asked, hey, can you write me a note? I don't feel good about returning to work or going to work because I've got diabetes and heart failure, and I'm obese, and I'm 60 years old, you know, and for some of those people I've written them a note saying, you know, you've got multiple health issues that if you were to contract COVID-19 disease, could be life-threatening. I've had other people that just feel uncomfortable, and I'll say, hey, if you wear appropriate, if you practice good hygiene, if you wear appropriate, you know, wear your mask, practice good hygiene, wash your hands, keep social distance, practice common sense, you ought to be able to go back. So it'll be a case-by-case basis, but yeah, you know, there's going to be people that are uncomfortable and going to ask, and it puts us in a predicament to
Sure.
figure that out on an individual basis even.
But certainly the more conditions you have that have been identified as problematic conditions with COVID-19, the greater our concern would be, and the greater concern that the employer and the employee should have. And, you know, I think everybody should be, you know, the employer should be concerned, you know, hey, we got to get back to work. We want people to come back. But if we push too many people too quickly, then we have a spike and everything has to be shut down. So I think it's really all about walking a fine line of having enough concern, but not being so overly concerned that, you know, we either go crazy with anxiety or we, you know, just start quarantining ourselves and, you know, nobody goes back to work. So it's just following a lot of the guidance that Dr. Stiles mentioned, hygiene, common sense, social distancing, wearing a mask. And yeah, you know, we wear masks largely to protect other people, not to protect ourselves. I mean, to an extent, we're doing it to protect ourselves. But I mean, I work here in a clinic, and I'm potentially, you know, exposed to coronavirus all day long. So if I go to a place like Kroger or Lowe's or Walmart, you know, I'm wearing a mask, not because I'm so scared of it, but because I don't want to spread this virus to other people that might be there.
So much so, you don't want to spread it so much so that I believe that you were living in an RV for a period of time, right?
That's right.
I think
Yeah.
for all the information that you shared with us today, gentlemen, very useful information for both employers, employees, and just everyone in general. When I think about this disease, every time I think about it, the same picture kind of comes to mind. And I think about one of those like circus performers that have the sticks with the plates spinning around and around, you know?
Right.
You're just trying to figure out which one's going to fall first, or try to keep them all balanced. And so I know that that's probably more true for you all in the medical profession than anyone. And so again, thank you for your commitment to not only the profession, but to our community as well. From the Chamber's perspective, I know that you all have been great members, have been great supporters of the Chamber and all that we try to accomplish. So we also appreciate that as well.
I was going to say, and on that line too, you know, if anybody in the Chamber or even businesses that aren't in the Chamber, if they have questions and concerns and they want to ask a specific question, you know, I encourage them, call, ask for somebody to get in contact with them. We have 14 providers here. We've got, you know, 5 or 6 physicians and 7 nurse practitioners. So, you know, if somebody's got a question and they're just unsure and they want clarification, you know, we can't talk about a particular patient. We can't, you know, for HIPAA and all that kind of stuff, but we can talk in generalities about certain cases or certain instances, circumstances, and, you know, help, you know, if people need help.
Absolutely. Well, thank you so much again, gentlemen. And just so you know, I will reiterate, Hardin Memorial Health Family Medical Center, and also to Dr. Sindler is with the Nelson County Community Clinic. But certainly appreciate it, you all, and we welcome you back anytime. Thank you so much. Have a great Memorial Day.